Welcome to our First Finishers Safety Training. First, we'll learn about keeping safe in smoky weather and conditions. Washington workers who may be exposed to a potentially unhealthy amount of wildfire smoke must get trained on how to stay safe around smoke. Here's the topics we'll be discussing during this training. Wildfire smoke is a hazardous mixture of gases, liquid droplets, and fine particles. Unless you are working near a fire, the greatest hazard from wildfire smoke is from fine particles. Of this mixture, particles that measure less than 2.5 micrometers in diameter have been identified as being the most hazardous. We call these tiny hazardous particles PM 2.5. Working in wildfire smoke can be dangerous. It can cause health problems like coughing, headaches, and difficulty breathing. More serious health problems linked to wildfire, smoke inhalation include reduced lung function, bronchitis, aggravated asthma, heart failure, and even early death. Anyone can become sensitive to smoky air. Having a recent lung illness, having to spend a lot of time in smoky air, or doing hard work in smoky air can make you at risk for severe illness. Some workers are more sensitive to air pollution and have a higher risk of health effects from wildfire smoke exposure. These include workers with heart or lung diseases, those who smoke, workers with respiratory infections, workers with heart or circulatory problems, workers with diabetes, pregnant workers, and workers younger than age 18 or older than age 65. If you or someone you know is experiencing trouble breathing, chest pain, dizziness, a fast-beating heart, or severe cough, or any other symptoms that are concerning to you, call 911 or seek emergency medical care immediately. There are many readily available tools that report on local air quality throughout the state of Washington. Some sources of air quality information are listed here. These sources of information use real-time air quality data to create their own air quality score, including PM 2.5 data, and the Air Quality Index, AQI. For this training, we will focus on the Air Quality Index, which is easily available by visiting airnow.gov. If you cannot access these information sources, contact your employer for current air quality data. There are two ways air quality is reported. Fine particulate matter, or PM 2.5, is reported as micrograms per cubic meter or as an air quality index for PM 2.5. You can use either number, AQI or MG/M3, just so long as they are reporting PM 2.5. To find the air quality in your area using AirNow, open the website or app and search for your location. Step 3, AirNow will display your air quality index. In this example, the air quality index for PM 2.5 is 98. This picture is just an example for training purposes and does not reflect current conditions. Now you know how to find your air quality index. So what now? How does knowing this information affect your safety at work? The Washington Wildfire Smoke Emergency Rule has defined two air quality action levels. When the air quality index in your area meets or exceeds one of these numbers, your employer is required to take action to protect your health. An air quality index below 69 is generally considered safe for most workers. Workers who are at a higher risk of health effects from wildfire smoke exposure should take appropriate precautions. An air quality index at or above 69 indicates an air quality hazard. At this point, your employer is encouraged to take action to protect your health. Everyone should watch for symptoms of wildfire smoke exposure. An air quality index at or above 101 indicates a serious air quality hazard. At this point, your employer must take stronger action to protect your health. We'll discuss these employer requirements in a moment. In our example, AQI of 98, the employer would be required to implement safety precautions. Keep these action level numbers handy so you can refer to them when you need them on the job. At AQI 101, respirators will be provided to you. Respirators can effectively protect employees from the hazards of wildfire smoke exposure when properly selected and worn. Respirator use can be beneficial even when wildfire smoke levels are relatively low. When provided by the employer, respirators must be appropriate for the air quality hazards in the workplace. The left video shows an example of an N95, also called a filtering facepiece respirator. Employers may choose to provide other, more protective respirators. It is important to point out that some common items will not provide you with adequate protection from wildfire smoke. These items include surgical masks, face masks, KN95s, bandanas, scarves, or t-shirts worn over the nose and mouth. Talk with your supervisor about respiration protection options that are appropriate for your work situation. For safe and effective respirator use, follow the manufacturer's instructions on how to use and maintain your respirator. Pay attention to warnings regarding the respirator's limitations. Make sure your respirator will protect you from the air quality hazards in your work area. Be aware of your respirator's limitations. A filtering facepiece respirator, such as an N95, is designed to filter airborne particles and will not protect you in an oxygen-deficient atmosphere or in the presence of hazardous gases or vapors. Keep track of your respirator so it is not mixed up with someone else's. There are many ways to do this, but do not write, paint, or mark directly on the facepiece, as this can degrade your respirator's effectiveness. You may not be able to wear a respirator with certain medical conditions. If you have concerns, talk to your doctor. A respirator will be much less protective if facial hair prevents the respirator from forming an effective seal over the nose and mouth. The person in this video has facial hair that prevents the respirator from adequately protecting him. In order to receive the best respiratory protection, respirator users are encouraged to shave any facial hair that may interfere with effective respirator use. Some workplaces have workers younger than age 18 who are exposed to wildfire smoke on the job. These youth workers must also be protected from the effects of wildfire smoke exposure. When the AQI is 101 or more, employers must provide respirators that employees can use to protect themselves from wildfire smoke. This includes providing respirators to youth employees for their use. Please remember that youth workers are at a higher risk of health effects from wildfire smoke exposure due to their age. Normally, workers younger than age 18 cannot work in jobs where respiratory protection is required. When wildfire smoke is present, please consider alternate work arrangements that will reduce youth workers' exposure to wildfire smoke. For additional information regarding youth employment, please contact your local L&I office to speak with a youth employment specialist. Your employer has certain responsibilities under the wildfire smoke emergency rule to protect worker health. When employees may be exposed to wildfire smoke, employers must determine employee exposure to wildfire smoke before and periodically throughout each shift. Encourage employees to report worsening air quality and any health effects due to air quality, and inform employees of available protective measures against wildfire smoke. As an important reminder, your employer is never allowed to retaliate against you for reporting an air quality hazard, an adverse health effect, or for seeking medical treatment due to a work-related illness or injury, including exposure to wildfire smoke. Report to any supervisor, office staff, or owner. When workers may be exposed to wildfire smoke at PM 2.5 of 20.5 micrograms per cubic meter or more, employers must train workers on wildfire smoke safety. You are encouraged to wear respirators. Employers are encouraged to limit employee exposure to wildfire smoke at these levels. Such controls can include changing work schedules, relocating work, providing portable HEPA filters for enclosed areas, or providing enclosed buildings or vehicles with filtered air. When the air quality is at 555 milligrams per cubic meter of PM 2.5, one of the listed respirators, or a respirator that is at least as effective, is required to be worn if working outside. Take these precautions to protect your health when working in the presence of wildfire smoke. Watch for changes in air quality. Air quality conditions can change significantly throughout the workday. Notify your supervisor or another management representative if you notice air quality getting worse. Know the symptoms of smoke exposure. These include asthma attacks, difficulty breathing, chest pain, and others. Notify your supervisor. If you experience any adverse symptom of smoke exposure, stop what you are doing and notify your supervisor. During this training, we discussed how to identify the hazards of working near wildfire smoke, how to locate air quality data for your work area, how to recognize when wildfire smoke precautions are required, how to properly use a filtering facepiece respirator, such as an N95, and how to take action when air quality conditions worsen or you experience an adverse health effect from wildfire smoke exposure. The hard truth is that working near wildfire smoke is an unavoidable reality for many Washington workers. Even though we can't completely eliminate the hazard of wildfire smoke, use the knowledge and skills you have learned to keep yourself safe. Speak up if you experience any ill effects from wildfire smoke. By following the requirements of the Wildfire Smoke Emergency Rule, together we can keep Washington safe and working. Next, we'll talk about water, rest, and shade. Working safely in outdoor heat. Working outdoors in the heat presents a serious hazard to employees in many types of industries. Agriculture, construction, forestry, transportation, and utility work are just some of the industries where workers risk developing heat-related illness. Washington L&I has released an updated permanent workplace safety rule to protect workers in all industries from outdoor heat, effective July 17, 2023. This new permanent outdoor heat safety rule is in effect year-round whenever workers are exposed to hot conditions, as identified in Washington Administrative Code, or WAC, 296-62095 for general industry, and WAC 296-37097 for agriculture. Many different factors affect how a worker responds to heat exposure, including the employee's workload and work duration, the clothing and personal protective equipment worn, personal health characteristics such as age, physical fitness, certain medical conditions, including pregnancy, certain medications, and history of previous heat-related illness. Behaviors such as water consumption or alcohol use. Remember, alcohol within 24 hours impairs your body's ability to cool itself. The employee's degree of acclimatization, meaning the body's adaptation to working in the heat. This adaptation can be gained and lost over time. We'll talk more about acclimatization toward the end of this presentation. As temperature rises, the risk of heat-related illness increases. Under the new outdoor heat safety rule, employers must take specific steps once the temperature reaches certain thresholds. The threshold depends on the type of clothing employees wear. If the temperature reaches or exceeds 52 degrees Fahrenheit and employees wear non-breathable gear, for example, vapor barrier clothing or chemical-resistant suits, or if the temperature reaches or exceeds 80 degrees Fahrenheit for all other clothing. Make a note of these threshold temperatures. We'll refer to them as we discuss how to stay safe when working in the heat. Acclimatization is another important factor helping employees adjust to working in hot conditions. According to federal OSHA, the body gradually adapts and tolerates higher levels of heat stress. Research shows almost half of heat-related deaths occur on a worker's first day on the job. Over 70% of heat-related deaths occur during the first week. Workers, especially new hires, need time to become acclimatized to avoid heat-related illness and death. As you slowly increase your time working in the heat over several days, your body develops a heat tolerance. If you're away from working in hot conditions for a while, you lose that tolerance. During acclimatization, take frequent cool-down breaks and drink plenty of water. Heat waves, when temperatures spike 10+ degrees above the previous 5-day average, are especially dangerous because the body doesn't have time to adapt to the sudden increase. In a heat wave, take extra breaks, drink water, and watch for any signs or symptoms of heat-related illness. The 3 keys to working in the heat are water, rest, and shade. Water. By drinking water regularly, you help your body stay hydrated, which in turn helps you stay cool in the heat. Drinking small amounts frequently over time, like 1 cup every 20 minutes, is better than chugging a lot all at once. You might need even more than that to stay comfortable. When the temperature outdoors reaches the threshold, 52 degrees Fahrenheit in non-breathable gear or 80 degrees Fahrenheit for everyone else, First Finishers is required to provide each employee with 1 quart of cool water every hour. Low sugar, low caffeine, electrolyte replenishing beverages, like sports drinks, can substitute for plain water. First Finishers also provides electrolytes that you can stock in your vehicle, plus cooling towels for every employee. Rest. Rest is an important way to prevent heat-related illness by allowing your body to recover from working in the heat. Do not wait until you feel unwell. Taking regular cool-down breaks helps you avoid illness later in your shift. Remove any heat-retaining, non-breathable clothing during your rest period to maximize cooling. In severe heat, preventive cool-down rest breaks are mandatory. Employers must implement mandatory rest periods beginning at 90 degrees Fahrenheit. Shade. Whenever possible, take your rest breaks in a shaded area to escape direct sunlight. When temperatures reach 80 degrees Fahrenheit, for standard clothing, first finishers is required to provide shade if natural shade isn't available. We have canopies for this purpose. The shaded area must not be next to a source of radiant heat like machinery or concrete. Must be close to your work area, if possible. Must fit all employees on a meal or rest break comfortably. Other cooling methods, such as misting stations, cooling vests, or air-conditioned areas, may also be used. Even when we work to prevent it, heat-related illness can still occur, even in young, healthy people. Heat-related illness is a serious health reaction that happens when the body cannot cope with the current heat. Every year, workers die on the job due to heat-related illness. Pay attention to the signs and symptoms of heat-related illness and take action as soon as you or your coworkers begin to feel unwell. Your health depends on it. Heat-related illness can take many forms. These include heat cramps, heat rash, heat exhaustion, heat syncope or fainting, rhabdomyolysis, and heat stroke. We will talk about each of these types in detail. Heat cramps are muscle spasms or pain. These usually occur in the legs, arms, or trunk of the body. Heat rash has the appearance of clustered red bumps on the skin. These usually occur on the neck, upper chest, and skin folds, such as under the arms. Make sure you are showering and/or changing into clean clothes after work, or this can lead to heat, rash, and infection. If you notice heat rash, make sure to keep clean and dry. Heat exhaustion is a more serious form of heat-related illness. Workers with heat exhaustion may experience fatigue, irritability, thirst, nausea or vomiting, dizziness or lightheadedness, heavy sweating, elevated body temperature, or a fast heart rate. Workers with heat syncope experience fainting and dizziness. Whenever a person working in the heat loses consciousness, that person needs urgent first aid. Rhabdomyolysis is a serious form of heat-related illness where muscle tissue begins to break down. People with rhabdomyolysis typically experience muscle pain, dark urine, low urine output, and overall weakness. Heat stroke is the most serious form of heat-related illness. Workers with heat stroke may experience confusion, slurred speech, loss of consciousness, seizures, heavy sweating, hot, dry skin, very high body temperature, or a rapid heart rate. Heat stroke is a health emergency. Take action quickly and call 911. When you begin to experience signs and symptoms of heat-related illness, or you observe a coworker feeling unwell, stop what you are doing immediately. Report those symptoms to the appropriate person at your worksite. Heat-related illness can look different in different people. When you feel unwell, it is always better to report it, even if you are not sure it is due to heat-related illness. Workers who experience mild cases of heat-related illness require first aid. This may be as simple as moving the person to a shaded area, giving them water, and allowing them time to rest. The person experiencing heat-related illness will also need to be closely observed to ensure their condition gets better rather than worse. Be sure to ask your employer about specific procedures for first aid and close observation at your worksite. In more severe cases, heat-related illness becomes life-threatening and emergency responders will need to be called. First finishers policy. If you notice symptoms in yourself, immediately notify a coworker who should contact the supervisor immediately as you rest in shade and drink water. If necessary or in doubt, call 911. Make sure you are aware of your location and that emergency services has a clear path to the employee needing medical attention. If mild symptoms, your coworkers and supervisor must monitor and determine if employees should go to a close medical facility. From federal OSHA, employers and workers should become familiar with the heat symptoms. When any of these symptoms is present, promptly provide first aid. Do not try to diagnose which illness is occurring. Diagnosis is often difficult because symptoms of multiple heat-related illnesses can occur together. Time is of the essence. These conditions can worsen quickly and result in fatalities. When in doubt, cool the worker and call 911. For more information from federal OSHA regarding first aid for heat-related illness, please visit federal OSHA's heat exposure webpage. Some workers may be afraid to report heat-related illness or to take a cool-down rest break when they need one. Remember, your employer is not allowed to retaliate against you for reporting signs or symptoms of heat-related illness or for seeking medical care for heat-related illness resulting from outdoor work. Your employer also cannot retaliate against you for taking a cool-down rest period when you feel the need to prevent heat-related illness. First Finishers encourages you to listen to your body. Take additional breaks whenever needed. It is better to be safe than to risk a heat-related illness. Please keep coworkers and supervisors informed if you feel any symptoms. Heat-related illness is a serious workplace hazard, but it is a hazard that can be prevented. As you prepare to work outdoors on a hot day, remember the 3 keys to working safely in the heat: water, rest, and shade. Take a cool-down rest period if you need one. And most importantly, speak up and report any signs or symptoms of heat-related illness. The information presented here will help you stay safe and healthy at work by avoiding heat-related illness. Together, we can all be heat smart.